It's interesting because as physician scientists, we think the most convincing evidence out there is a randomized controlled trial. But the truth is, we respond to personal anecdote and audiovisual communication.
You are now listening to Scalpel MD.
Sorrel MD. So, after 9 p.m. on a Friday night, after a delicious dinner of pizza, wings, and beer, I started watching episode 3 of the Without a Scalpel docuseries on my Amazon account. So what's the review? It's a great documentary, excellently produced. It's created by a group called the Interventional Initiative. All right? This is a group of IR physicians with the sole purpose of putting IR onto everyone's radar. All right? And I initially thought this episode was going to be on uterine fibroid embolization, but it turns out that the whole episode is on a less well understood topic, and that is pelvic congestion syndrome. So as a recent IR fellow at a great institution, we really did not see that many cases of pelvic congestion syndrome. Not only that, but as a resident and a medical student, this was a disease entity that I really was not exposed to much. Right? I was always taught that this is a vague disease, a disease that we're really not sure is quote-unquote real. Right? So what is pelvic congestion syndrome? Well, in some ways it's kind of simple. It's a varicose vein that's inside the pelvis. See, blood in veins is supposed to flow upwards toward the heart. Varicose veins reflux, and that blood stays stagnant inside the vein. So in the legs, this causes an obvious disfigurement, pain, and then sometimes bleeding. All right? But in the female pelvis, this stagnant column of blood congests the pelvic organs, the uterus and ovaries, and results in pelvic pain. The worst thing about this disease is since that abnormal vein cannot be visualized by an examining physician, the pelvic pain is often attributed to a psychiatric illness, all right? A so-called state of hysteria. All right? So hysteria, the definition per Google is a complex neurosis in which psychological conflict is turned into physical symptoms that have no underlying physical cause. All right? Said another way, oftentimes a physician that was seeing these type of patients simply thought that the patient was crazy. I think the craziest thing is that the word hysteros is actually a Greek word for uterus. All right? So in a sense, hysteria is actually a good name because this is really a disease of the uterus. This is a uterine venous congestion. The documentary features 3 women who have pelvic congestion syndrome. They describe how they go through a Rolodex of doctors before finally getting diagnosed, in this case by an interventional radiologist. All right. The IR physician in the segment is Dr. Stephen Smith, a senior interventionalist at an IR practice in Chicago. He really delves into the many themes of treating pelvic congestion syndrome, including the theme of paternalism in medicine, where oftentimes a male physician makes a far-reaching decision on patient care that is not in the best interest of a female patient. A great part of this documentary is when they show the actual procedure. A patient with pelvic congestion syndrome gets on the table, and Dr. Smith starts off doing a venogram and actually diagnoses a May-Turner compression on the table. All right? In fact, even I could see from where I was sitting on the couch the rarefaction of contrast in the left common iliac vein that makes this diagnosis. He then shows a clip of him placing a wall stent at the obstruction to treat this entity. A great case. He also goes on to interrogate her gonadal veins, finds them to be refluxing and enlarged, and places several coils in them to block flow to the vein and then treat the problem. The documentary shows all 3 women in follow-up, and they all have resolved their symptoms and are so happy to be done with this disease. It really makes me believe in how powerful this treatment can be. It's interesting because as physician scientists, we think the most convincing evidence out there is a randomized controlled trial. But the truth is, we respond to personal anecdote and audiovisual communication. And to finish off, I'm reading a lot of abdominal pelvic CT. I know I see dilated gonadal veins not infrequently. Going forward, I think I'm going to make more of an effort to put this into my impression and then communicate that finding to the referring doctors. I think we can do a better job of diagnosing and treating this entity. Overall, this is a great documentary, must-see for IRs and especially for medical students interested in IR. Make sure you log into your Prime account and check it out. That's all I got for now. Sorrel MD. Stay reading those CTs, guys.